Okay, so we'll just start with today. So I just worked all night. That's why I look tired because I was out all night. I had a patient fall and then I had a death. So when I do call, I do come home and I do sleep. I might get 2 to 3 hours. And then last night I was, went out at 2 a.m., had a patient that fell at a facility. We always go just to make sure that they haven't had any injuries and report the fall since the family's not there with them if the facility requested it. So I went to a fall, little lady Precious, and she was getting up and down constantly. This lady is, I go in, it's 2:30 in the morning. She's sitting straight up in the bed with the TV on, the lights on, and her special little animal sitting in her lap, which is so adorable. And she's just, wringing her hands with this animal. This same lady 2 weeks ago fell and busted her head open and had to get 12 stitches. And I was the nurse that went to go follow up on that fall last week in the middle of the night. And this little poor lady had, a dressing wrap all around where you could barely see anything. And she looks bad. I mean, I don't know what it is, but as we get older, when we fall, it just seems to get worse and worse every day. And it's just, black and blue. So she had already fallen. So this time she fell. She said her head was hurting. She's a dementia patient, but she did say that. So just to be careful, which was the right thing to do, they called and had us come out to assess her. So I get there, and she is sitting straight up in the bed, as I said. And I said, hey. And she was like, I fell. And I'm like, yes, I know that you fell. And she, hey. And so I see that her fall mat, which is what we get, it's a mat that we put on the floor next to the bed so that if they get out of the bed, they land on the mat instead of the floor, was on the other side of the room. So come to find out, this lady gets up and down throughout the night. I call it pilfering. They forget they can't walk, or they try to walk and they can't. And nighttime seems to be a big time that we see restlessness and agitation. I guess it's part of the sundowning for whatever reason. So when I go in and I see a patient that is awake at 2:30 in the morning, and she is been up and down all night, and all over the room, then my mind says that they are agitated. There is something kind of anxiety, agitation that is causing them to stay awake and causing them to want to get up, get down. Also, too, I asked her if she was hurting. She said yes, that her head was sore. Didn't see any injuries, but I did request that they give her Ativan, because Ativan is very good for calming patients, and then to give her something for pain. So, and then to, kind of see how that works so that we can maybe stop this lady from falling. So, her family member, a loved one, called me this morning and just really wanted to know, what can I do? What, she's been falling. She's fallen 5 times in 2 weeks before she came to this facility, and then last week she fell and had to go to the emergency room, and then she's fallen this morning, and she's fallen multiple other times. And what can I do? What can we do to prevent this from happening? Is there anything that we can do? So I explained to her that honestly, we cannot prevent a patient from getting up. We can't use restraints. If a patient's up and down, we can't prevent them from doing that. The only sure way that you can keep a patient from hurting themselves that is either in a facility or home, whatever, and is confused in any way, is to have a sitter that is there with them around the clock. And most people cannot afford that. And facilities just don't have the staff for it. Some facilities will take a patient that's awake all night, bring them in there where they're at, and they will walk and walk and walk and walk and walk. Some patients get their days and nights mixed up. But the majority, they can't be everywhere. So when you have a patient, anybody that wants to keep their family member at home, if you are at a point to where they are in this place at home, and you can't do anything, they're going to hurt, they're going to hurt themselves. You still have to go to work. You still have to do these things. That is when it is a good time to think about a facility. If they are in a facility and that is not helping, then that is a good time to think about a sitter. And if you don't have the money to get a private sitter, I always suggest asking a family member. Maybe there's a college student that just wants to make a little bit of extra money for the summer, or, a grandchild, or, somebody that can just come and just sit and just be there to watch them get up and get down. And that is really the only way that we can guarantee that. But, of course, this time the course of action would be to see if, we could adjust the sleeping meds and get her sleeping. And so family member was very grateful for my call and for the information. She asked me if the fall mat did any good. It was on the other side of the room, but it doesn't do a lot of good when a patient is up walking around. I have seen beds be put on the floor, which is an excellent idea. But if they're walking, it's not going to help. Some of them just roll out of the bed. They just like to roll out of the bed. I had a guy last week, he fell 7 times in one day. So I named him Sir Falls a lot because I've never seen a patient fall that many times in one day. It just happens. And most of the time, they don't hurt themselves. I have literally seen them stand up, sit down on the floor, swim, help me, help me, help me, and they were okay. I mean, they most of them don't understand what's going on, your dementia patients. So anxiety is very common with that disease process, especially as they get closer to the end of life, even if it's just a few years. And every time that a patient falls for whatever reason, and if you're a caregiver, you know this, they never go back to their baseline, even if they didn't hurt themselves. I don't know if the body just, I don't know. I'm sure somebody can tell me the clinical reason for that, but just from what I see, which my opinion means nothing, I'm not an expert, maybe the body is too busy worrying about other things than it is the brain. And, in dementia, the brain is dying, so they forget they can't do these things. So that is one of the things that came up today was, can I prevent my family member from falling? And what do we do to stop them from breaking their neck? And that was my response.